All right, folks, very, very simple little video to help illustrate the difference between pulmonary and systemic circulation. So I'm going to draw a very simple diagram of the heart, and of course we know the heart is not shaped like this, but that's good enough for today. And this is my right hand, so this is the right side of the body. There's my right atrium, left ventricle, and my right ventricle. So if I just write over here the body, which would be everything except for your lungs, over here I'll write lungs. So we know that the blood coming from the body is deoxygenated because your organs, all your tissues, your muscles and so on have used a lot of the oxygen through the process of cellular respiration. So I'm going to use blue to indicate deoxygenated blood. We know that blood's never really blue. It looks blue in your veins, perhaps not because the blood is blue, but because of the pigments in the tissues of the veins themselves. The blood is, however, a little bit darker, more purpley or red than arterial blood. Okay, so we have deoxygenated blood coming from the body to the right side of the heart, specifically to the right atrium. That right atrium contracts, puts blood into the right ventricle. It's still deoxygenated, of course, and from there the right ventricle is going to pump blood to the lungs. Here we have gas exchange occurring, and the blood's going to pick up oxygen and give off CO2 to the air in the lungs. Then the blood will continue from lungs to the left atrium, to the left ventricle, and the left ventricle pumps blood back to the body to deliver that fresh source of oxygen again. Right, so those are the two loops in the system, and when we are looking at this loop, so from heart to lungs back to heart again, this would be the pulmonary circuit. Pulmonary refers to lungs. And the loop where we go from the left heart to the body back to the right heart, that would be your systemic. Okay, so we can be a bit more specific. We can say from the left heart to the body to the right heart, that's going to be your systemic circulation. Whereas if we go from the right heart to the lungs for gas exchange, and then back to the left heart, that would be your pulmonary circuit. Hope that helps clarify things.